Hi everybody, this is the short version of the long presentation on how to deliver bad news to parents of pediatric patients in the emergency department specifically. First things first, know a child's name. It's very, very important, especially when we get a lot of DOE patients who come in as trauma. Before you go in a room, ask the nurse, ask the social worker, what is the child's name? Next, make sure you have a room that is quiet, minimize distraction, turn off your cell phone, turn off your beeper, have some water, have some tissues available. It's going to be a highly emotional situation. Minimize the distractions, such as I have snot coming out of my nose and I don't know what to do with it. Have tissues available for parents. Once you set up the room, go into the delivery portion. Introduce yourself, tell them what your role is, and once you've done that, give them a fair warning. Tell them something along the lines, I am afraid I have some bad news for you. And shortly after, tell them the news. Your son, Jimmy, has died. Do not use cutesy words. Be direct. Use direct words such as death, such as dying. It doesn't help anybody if you're ambiguous. The patient did not pass away, the patient died. Delivers a clear message to the audience. And once you've done that, be quiet. Allow for silence. I know this is the most difficult part for us, to just sit quietly. Silence is uncomfortable. It makes you want to fill that void. Try your best not to just say things because you want to fill the void. If you sit quietly and allow the family to respond, they will ask you questions that will guide you to answer all their fears, answer their suffering. And most importantly, they will ask you questions that will allow you to ease their guilt. Parents, if you're a parent, you know the guilt that comes to when your child is suffering. You know the guilt that comes if, God forbid, you lost your child. It is painful, and the parent will feel guilty. Find one thing that the parent did well and encourage the parent. Tell them, you're the one who did CPR. You're the one who recognized that there's something wrong with the child. You're the one who called 911. I had a mother whose son had leukemia. Now, for 1 month, she has taken her son to 4 different doctors. And everybody, highly educated human beings, told her, your son is okay. Her motherly instinct told her otherwise. There's something wrong with my son. Finally, she presented to our ED. It turned out her son did have leukemia. And regardless of the fact that it's because of her that her son was finally getting the treatment, she couldn't shake the guilt. I spoke to that guilt and I encouraged her because her persistence got her son the treatment that he needed. Find one reason to encourage that parent and ease that guilt. And once you've done that, be available to repeat yourself, be available for follow-up. You will be able to, and you will have to go back multiple times to repeat yourself, to tell the parents the same thing until finally they understand. I had a patient, I was concerned for malignancy again, and first time I told the parents, it didn't quite click. 5 minutes later, they asked me to go back and tell them again the same thing. 10 minutes later, I've done the same thing, and the 4th time, finally the parents broke down in tears and they realized the gravity of what I was telling them. Be available for your patient, be available for their family, because this is the only thing that you can do that will have a lasting impact in that family's life. You will never see them again, especially if they lost their child, but they will remember who was the person who delivered this news to them. Thank you very much.